Hi everyone, I'm Janae. I am one of the adult infusion nurses in the North Infusion Center. Welcome to chemo class. Chemo class usually takes about an hour and a half to go through everything today. And if you have any questions or concerns, please feel free to reach out to us either through the patient portal or call the clinic, and you can reach the infusion center or your physician if you have any questions. So before we start, this is an online class providing general information on chemotherapy, immunotherapy, and targeted therapy for cancer patients. For more specific information on your treatment plan, please contact your oncology team. Please refer to your resource binder for more information regarding contact information for your team and departments at the UC Davis Comprehensive Cancer Center, your treatment therapy plan, and resource information. So what we'll discuss today: what is chemotherapy and immunotherapy, preparing for your first day of treatment, what to expect when getting chemotherapy or immunotherapy, feeling your best during your treatment, and supportive oncology and survivorship resources that we have here at the Cancer Center. So where are you going to go for your first treatment? So the top three pictures that you see are the North Infusion Center in the north building of the Cancer Center. And then the bottom two photos that you see are an example of the Rockland Infusion Center. So if you live out in that direction, you can ask about getting your treatment out in the Rockland Infusion Center. Some chemotherapy may be given during a scheduled admission to the Davis 8 unit as well. So if there's a risk for reaction or your treatment takes a long time to infuse into you, they'll sometimes admit you into the hospital. You'll have your treatment and then get discharged home from there. What should I expect and bring for my first treatment? Try to rest the night before. I know it's easier said than done, but getting sleep is always going to help. Eat a light meal before coming to your appointment and try your best to relax. You have some of the best UC Davis Health team members who will take great care of you here, and we all work together as a well-oiled machine and great team. First infusion treatment is often longer, and subsequent treatments are a little shorter just because we have so much information to go with you over the first appointment. Infusion nurses or RNs will review your treatment plan, medication side effects, and home medications with you. So when you come in for treatment, we'll sit you down, kind of go over generally what's going to happen, start your treatment, and then during your infusion, we'll sit down and go at length over your specific medications and your regimen. Some treatment medications are given more slowly during the first infusion as well, so that's why it sometimes takes a little longer the first time around. What should I expect and bring with me when you come to your first appointment? What I should know about my first infusion appointment: you may bring somebody with you. We ask that one visitor is permitted in the infusion room at a time just because the space is a little limited, and that's by the fire marshal, not us. No children under the age of 13, and that's just for their safety because there can be exposure to trace chemotherapy while you're in the infusion center. Your home medications, nausea and pain medicine that your doctor has prescribed, definitely bring those with you. We do not have a full range of medications that we have access to. So if you have a home prescription medication for like blood pressure or diabetes that you take at a specific time of day and you're going to be seeing us at that time, make sure to bring it with you because we don't have those medications on hand most of the time. The infusion nurse will also go over all of your home medications for nausea and vomiting with you when you come in. We'll tell you what to take first and when you can take it, how often, and what to do if those medications don't work. Bring something to occupy your time. So we do have access to free Wi-Fi, so you can bring a laptop, iPad, your cell phone with you and connect to the Wi-Fi, watch TV or listen to music. We just ask that you bring headphones with you so that you don't disturb your neighbors. You also can bring books in. We have DVD players and a selection of DVDs you can watch as well if that's something that you're interested in. Bring a small snack or meal with you. So if your treatment's a long, 5-6 hour infusion and you are going to be with us during the lunch hour, make sure to bring some food with you because we don't have access to any food. We have some small snacks like tomato soup, chicken noodle soup, tea, crackers, and juice, that type of stuff, but there's not a full-blown meal available. If you do have a family member or a visitor that's with you, they are permitted to go out and get you food and bring it back in, as long as it's not strong smelling like fish or popcorn, something like that might make other people nauseous. We don't have any refrigerators available to hold food in, so make sure to put some food on ice if you're worried about it spoiling. We do have microwaves though, so if you wanted something warmed up, you are able to warm your food up. Dress in layers, we recommend wearing loose, comfortable clothing and lots of layers just because sometimes our infusion center might be on the warmer side and other times it's pretty chilly in there, especially when you're getting infusion fluids through the IV. The IV fluids are the temperature of the room, so you can get chilly because I always say we're turning you into a human popsicle from the inside out. So wear lots of comfortable clothing. If you have a nice fuzzy warm blanket that you love to use at home, bring it in with you. We do have warm blankets that we can offer you as well. And then the other important thing with wearing layers is just make sure it's loose clothing, especially if you have a portacatheter or a PICC line, so that we can access that site and easily access it. It has to be a sterile procedure, so we need to make sure that your clothing isn't touching that area. So important Cancer Center contact information is listed in your resource binder. It should be in there in a few locations, and we'll go over the numbers probably repetitively with you during this video, just so that we make sure that you have the numbers on hand for if you need to get a hold of us in the clinic or after hours. So the Cancer Center main clinic number is the 916-734-5959 number, and you can reach the infusion center, the pharmacy, radiation oncology, and the clinic. So that is a great number to have on hand. After hours, weekends, holidays, there isn't anybody available to answer the phones, and so what you want to do is call the main hospital after hours, so that's 916-734-2011. You ask for the doctor on call for your physician, and somebody will give you a call back. I believe they usually try to call back within about 30 minutes, and if it's something like your nausea is not being controlled well at home, what they'll do is prescribe some medication for you and resolve the issue so you don't have to come into the clinic or into the emergency room. If it's something serious like you have a nosebleed that's not stopping, they're going to tell you to go be seen in the emergency room so that it can be addressed right away. For the Rockland Infusion Center, there is a direct number to them. It's the 916-295-5880. And you can also, I believe, get a hold of the Rockland Infusion Center through the Sacramento Cancer Center phone number, that 5959 number. Radiation oncology is also available at 916-734-5810. And then the Davis 8 Oncology Unit for scheduling admissions is that 703-3080 number. Not everybody's going to need to know that, but we do have patients that are on regimens where you'll be getting treatment 7 days a week, and we aren't open on Sundays. So what they will do is admit you on a Sunday into the Davis 8 Oncology Unit. You'll get your chemotherapy and then be discharged home. Patient relations, for any compliments or complaints that you might have, any issues you need addressed, you can get a hold of the patient relations number at 916-734-9777. And you can also ask to speak to our manager in the infusion center if there's an issue that you need addressed right away. So up next is Melina. She is one of the RNs in the clinic here at the Comprehensive Cancer Center. She's going to be going over what chemotherapy and immunotherapies are.